I think there have been a number of gains. I think that ease of use and radiologist satisfaction have been areas of gain, and I also believe that efficiency of workflow has been a major area. I would say compared to other systems I've used, it's quite easy. Once again, what the radiologist needs to accomplish, what his work status is, what the priority is, are very obvious now. The contacts that are made as to what tasks are necessary to get done he doesn't have to call, somebody doesn't have to call him, somebody doesn't have to send him a message, are much easier. So I think it's been a major improvement. I would say in general the speed of image delivery is excellent. It can depend on some technical factors, but I would say that the image speed, the studies generally come up immediately, and there is really no delay. And even with large studies, obviously some of the larger brain or breast studies take a little bit longer, but compared to what we had before, there's been a major improvement in speed. Well, in our practice, we do have a number of radiologists who are reading off-site, some of them continents away, and really we're able to interact with them just as we would a colleague, right in the next room. And I often have my own reading station, and we're able to read off-site. We have our fellows for weekend calls are able to do so and still do the other things they need to do, going around and taking care of patients. I've been here for about 6 years, and I would say that due to some of these factors, I've been able to increase my productivity probably in the 10 to 20% range. It has impacted collaboration positively. We're able to have a number of additional radiology faculty involved. Before, really, it was pretty much confined to the people on site, and now due to this system, everybody basically having the same sort of arrangement, the ability of the faculty member to look at images with the fellow and see what their work list status is, has made it so that we can involve a broader range of specialists and their input, and add their input, and once again without really compromising efficiency or turnaround. One, I think we have better access to the clinicians. We have all the contact information right in front of us. We have their notes, right in front of us. So we're able to make an interpretation that makes more sense because it takes the clinical situation into account. So when we call a physician, we're able to do so on a much more informed basis than if we're, have somebody searching around trying to find the records. I think we also are able to, once again, on an urgent case, we find out about it sooner, get it read sooner, and get back to the clinician sooner than we were able to otherwise. They get their report sooner because it's been able to be dictated and edited in a more efficient manner. Okay, so I think the information, the turnaround time for the customer and clinician are going to be major benefits to the referring physicians. Dictation is much faster and more accurate, fewer corrections needed, corrections made at a more appropriate time. Radiologists using it are just going to find that it's a very efficient, time-saving system.